I've got a sneak peek. Well, thank you so much, and thank you for that very generous introduction. I'm really pleased to be here. I've heard a lot about the Center for Self-Center for Inequality Studies, right? I've been following some of your activities, and it looks like a really fantastic place. A lot of really interesting work going on here, and I'm hoping for some good critical comments on the material I'll present here. So this is a paper that I'm just finishing up, and that's a follow-on from a earlier paper which I circulated looking at looking at COVID and the informal economy in Africa. And COVID really generated a strong engagement with the informal economy that was seen to be requiring a much more extensive social protection response, particularly in Africa, where informal economies are very large, about 72% of the non-agricultural labor force for the whole of Africa. And the idea was that under COVID, because of the social distancing requirement, it would be necessary to try to expand as quickly as possible digital forms of cash transfers in order to protect large informal economies from the ravages. And this has triggered a really rapid expansion in sub-Saharan Africa, but with a much more strong digital component than was previously there. And one of the things that many people are saying about COVID, looking back on things, is it was a real epistemic moment for both research and thinking about informal economies, but also for thinking about the way in which informal economies are incorporated into the wider global and national. So the question that I'm trying to pose here is whether this epistemic moment was one of a transformative double movement against precarity, in which states and wider international institutions are focused now on better including informal economies in social protection systems, or is it more remoralization of the older neoliberal approaches to social protection, which have been rather flagging in Africa? The social protection agenda based on cash transfers was a bit of a hard sell across Africa, and people like Gillian Bashir, the Saatchi program in UNISA have been looking at the various ways in which there's a lot of pushing of these social protection processes, cash transfer systems. So is the idea of social protection in the context of COVID for informal workers protective of the informal workers, or is it focusing more on a protection of the neoliberal social protection agenda, revitalizing it and pushing it forward? And digital cash transfers themselves, to what extent do they transform informal livelihoods, meaning create a path out of precarity and informality? And to what extent do they rather just financialize precarious livelihoods? So in this presentation, I want to focus on three core contradictions, mainly on the second two, but I'll run very quickly through the first one. And the first one is about the ways in which the COVID-19 narrative about informal economies and about African informal economies in particular emphasized the uniquely vulnerable character of African informal workers in the context of COVID, because informal economies were so large and people were too poor on the whole to shelter in place because they had to work every day in order to survive. But sub-Saharan Africa overall had the lowest COVID mortality. So despite having the largest informal economies, they had the lowest COVID mortality rate, under 4% of COVID deaths, relative to being about 18% of the global population. The second contradiction is that informal labor reframed what informal workers are in the global economy. Previously, informal workers were seen as surplus labor. Under COVID, they've been reframed as essential workers. But the policy response to seeing them as essential workers is minimalist cash transfers rather than inclusion, better inclusion in labor laws, decent wages, decent work. So how essential are they if all they need is tiny improvements? Really, the cash transfer agenda is very much a sort of poverty top-up rather than something that will relaunch somebody's capacity to not only survive but prosper. And the third contradiction is that the parts of Africa with the smallest informal economies and the best digital social protection systems, Southern Africa, were associated with the highest rates of COVID mortality, and the parts with the largest informal economies and the worst social coverage of informal workers were associated with the lowest rates of COVID mortality. So that raises questions about how protective is digital cash transfer, our digital cash transfer systems in the context of informal realities in Africa, and who benefits from the rolling out of digital cash transfer systems. So just to very quickly look at contradiction number one, what is going on in terms of the COVID narrative and the realities of COVID mortality within Africa's very large informal economies. So it's kind of routine knowledge now that Africa has the largest share of people working informally, 72% of the non-agricultural labor force in Africa as a whole, including North Africa, 77% in sub-Saharan Africa. And there's been a very much a donor-led emphasis on the need for social protection to protect informal workers from COVID. The idea that Africa was uniquely vulnerable because of its large informal economies was highly publicized, and the point driven very heavily by big donor organizations, UN organizations, the ILO, the World Bank especially. Bill and Melinda Gates. Bill Gates said that unless social protection or action was taken on social protection, 10 million Africans would die by the end of 2020. The ILO emphasized the narrative. Informal actors are in a position where they are faced with either dying of the virus or dying of starvation unless proper social protection is put in place. And these sort of catastrophic predictions, the UN predicted between 300,000 and 3 million deaths by the end of 2020. Melinda Gates was talking about bodies in the streets. But if you actually look at the data, even by halfway through the first year of COVID, what it shows is there is generally an inverse relationship between the size of informal economies and the level of COVID deaths. And despite evidence coming up in newspapers and in various medical studies saying, funny thing, it looks like Africa is not that badly. It looks like it's, in fact, the death rate seems unusually low, and people started looking into the factors for that. Still, these large organizations, the Gates Foundation, etc., kept pushing this COVID unique vulnerability of African informal economies narrative. So just to look at some statistics very quickly, I used ILO informal economy statistics, size of informal economies, and the Worldometer statistics on COVID, which are reckoned to be fairly good. They're a little higher than the UN statistics and are a reasonable estimate of not just official statistics, but they cover newspapers and get wider reports of COVID deaths. So these two maps this is the map of the size of informal economies, and you can see that Africa is fairly dark, meaning very large ones, And this is the map of COVID death rates in Africa. It has the lightest blue showing that the COVID death rates there are not that heavy. So just to look very quickly at some statistics, this shows the size of informal economies in the first column, the share of total global COVID deaths, the COVID deaths per million, and then the coverage of the vulnerable by a cash benefit. So you can see that large informal economies, very tiny share, less than 4% of global COVID deaths. You can see the deaths per million are well under 15% of they are in more developed countries. And that's not because social protection was great. It's the lowest levels of social protection of all of these regions. And this inverse relationship obtains even in within African subregions. So you can see that Southern Africa has the smallest informal economy. It also has, West Africa has the largest. Share of COVID deaths is highest in Southern Africa and very low, nearly the lowest in West Africa. COVID deaths per million, similarly, the share of benefits much higher in Southern Africa than in West Africa. The argument has been put forward that's just a poor numbers issue. Obviously, places with large informal economies are worse at statistics. South Africa in particular is really good at statistics, and they have a really small informal economy. That's why there's this inverse relationship. But the studies of excess mortality have been quite unreliable. Both the Economist COVID tracking of excess death calculations, and there's an article by Wang et al. In the Lancet, both came to an estimate that excess mortality in Africa suggest that deaths were 14 times what they were reported. But there's a really useful article by Kabore et al., also published in a publication of the Lancet, that just looks at these figures on the one hand overtly, that they are totally implausible. 14 times the number of excess deaths means that nearly 500,000 people died of COVID in West Africa and over 1 million in East Africa. And somehow nobody really noticed. There were no news reports of apocalyptic death scenarios the way there were in Southern Africa. And that was very much on the news of overseeing all the devastation of COVID. But also in terms of statistics, it's the ways in which these excess death calculations were put together was by using modeling from Western countries to fill gaps in African COVID data. And the underlying health conditions, the socio-environmental lifestyle factors, many factors that affected COVID deaths in Africa were very different. So you can't use death rates from other places to fill gaps in African data. Kabore et al. Shows how you can use available African statistics to fill those gaps. I came up with an excess death model of around 3 times. The data I've used is about 1.5 times the death levels. All of these put African death rates very, very low. And that's so if if Africa overall, African informal were not uniquely vulnerable to COVID deaths, what's going on with the way we understand informal economies? And one of the things that COVID did was to shift the way, as I mentioned, we think about informal economies within the global economy. From the idea of large informal economies being an expression of surplus labor. There, as James Ferguson said, African labor has simply become irrelevant to capital. It's functionally irrelevant. Modern technology, globalization have just made all these people, something that is not needed. That narrative has completely turned 180 degrees to a reframing of large informal economies as essential workers. In the Western countries as well, informal workers are suddenly being put forward as essential workers, but this is much more extensive in sub-Saharan Africa. So the idea of essential workers, that narrative says, no, actually, informal workers are not surplus to the requirements of capital. They are essential actors in the running of contemporary cities and contemporary economies, both in production at the bottom of value chains, in service provision, in transport, in health work, etc. We need them, and they are essential to make economies run, and therefore we have to pay attention to them and to protect them appropriately. But it's important to keep in mind that the whole idea of essential workers, and the ILO has a new report they put out on essential work and trying to understand the role that it plays. There are two different meanings of essential workers. And the one that initially comes up in the report itself, and that was much more common in the global north, is that essential workers are about people who, they didn't put it this way, but this is the reality, are denied social protection and required to work because the system can't run without them. And that would be like meat packers in the US, where they were denied any access to furlough, sick leave was either not provided or extremely minimal. They were paid very low wages and were required in some cases to work. Agricultural workers here in South Africa also were required to work and were given very little protection and very little sick leave, even outside of the provisions of formal legal COVID requirements. And then the second meaning of essential workers is workers who have to have social protection provided to allow them to stop working because they are important and you need to ensure that they are safe. And that's the discourse that was much more used in Africa, among African informal economies, that they need social protection because they are essential, and you need to protect these workers and their ability to provide the needed services in the economy, but appropriate sick leave, health insurance, etc., to allow them to survive. So there are debates right now. Is this a revalorization of informal workers under COVID? Or does this involve this reframing, a shift in the mode of incorporation of informal workers in the global economy? And that prompts a kind of revisiting of the idea of surplus labor and what Marx actually meant by surplus labor. And there's a really nice introduction to a special issue by Nick Bernards and Suzanne Soderberg looking at this issue of surplus labor in contemporary economic thinking that really fits the issue here. And what they point out is that surplus labor is not about the irrelevance of particular categories of labor to capitalism, but about new modes of incorporation, pushing them out of the system in order to incorporate them down the line in a different way into the capitalist system. So these people are not permanently ejected. They are ejected for purposes of reconfiguring their relationship to capital. And the second issue is the importance of what's called secondary accumulation or indirect accumulation, which means workers that are used not for accumulation through production, but for accumulation through activities of social reproduction, which we've seen historically through a number of core activities like the company store in mines, where products are very highly priced so that very poor workers have to buy from the company store in order to survive, and accumulation is made. Consumption loans, slum landlords, all of these are ways in which social reproduction is turned into a mode of accumulation. And in contemporary times, microfinance and cash transfers have increasingly made informal workers and precarious workers relevant to capital and to global systems of accumulation in new ways. So there are new forms of accumulation in which exploitation and decommodification of labor actually meet rather than being opposed to each other. Now, if we look at the ways in which the digitization of cash transfers comes into this rolling out of social reproduction, there certainly has been a massive expansion of cash transfer systems and of social protection systems across Africa. And a few studies have noted that even by September 2020, much less more recently, there were 155 new measures in 43 African countries. About a third of these were cash transfer. They were the tendency, the acceleration of digitization was very, very high among them. And there's been an ongoing pressure to focus on digital cash transfers where possible. But the impetus for this was persistently through donors, World Bank, the IFIs more generally, not from society so much and not from states. Governments have been a bit uneasy about it, in some cases highly resistant. Is this use of our money? Do we want to invest all of this money in the infrastructure necessary, etc.? And there's been little focus in this rolling out of digital cash transfer systems on local needs, local capacities, the extent to which digital cash transfers actually maximize the accessibility of social protection for informal workers, and whether the infrastructural and administrative systems and capacity are there. And when you look at these, the kind of emergency drive to roll out these systems, it resonates very strongly with what Jimmy Adesina refers to as policy merchandise, which is the way that he has analyzed cash transfers in Africa more broadly. Packaging up something that works for the donors, for Western capital, into a need for Africa and pushing it in various political ways at the level of the state, despite the states in many countries being somewhat resistant, not because they're too corrupt, but because it actually doesn't look like the best expenditure of their resources. So zeroing in a little bit more on the digital side of these social protection agendas, there have been a few reports coming out of Southern Africa, coming out of the ODI in the UK, looking at the extent to which digital social protection is actually suited to informal workers in African contexts. And when you look at the realities on the ground, the reality is that about 50% of the population in Africa, in sub-Saharan Africa, lack reliable access to electricity. The digital connectivity is even weaker. Only about 46% of the population has mobile phones against 86% coverage in Europe. Only a third of the adult population have access to bank accounts. There are severe problems of documentation, of literacy, etc., which very much constrain the access of people working informally to these kinds of systems. And it begins to paint a picture of, to what extent is digitizing cash transfers a mode of access or a barrier to access for the reality. And in the areas where they tend to live, all of these things are even worse. These are averages across populations, but in the areas, the peri-urban areas and rural areas, electricity, access to mobile phones, connectivity, etc., are even poorer. So these digital systems are often incompatible with the realities of informal workers' lives, but also highly incompatible with the administrative and financial systems in African countries. The kinds of social protection systems, digital social registries, etc., that are necessary to make these systems work often don't fit with the pre-existing social protection systems, financial systems, etc., in many African countries. In South Africa, which has the most advanced digital social protection system on the continent, still hasn't managed to set up an effective mobile money system for distributing cash transfers, despite having tried to get it into place at the beginning of COVID. not because they are incapable of digital systems, but because they have pre-existing systems that don't fit the mobile money framework. And that means that there is a need often to call on private systems to set up the social registry, to set up the financial payment systems, to set up the various digital connections, which create a lot of space for a certain amount of slippage, corruption, both at the level of the private sector and at the level of the state, something I think South Africa is probably most uniquely aware of with all of their fun encounters with Net1. And you end up with a situation of rushed innovation in which a lot of these problems of targeting, problems of the state relating and being able to regulate these private mass social protection systems and payment systems, all of these get heavily entrenched with high levels of exclusions, with all kinds of targeting problems, etc., and with increasing problems in terms of democratic control. And Christina Lowe of the ODI actually said, when you look at all of these things, digitization of social protection of cash transfers may actually end up doing more harm than good. So we can see that the practical case for social protection is not strong, particularly at the level of informal workers. But one of the things that Lena Gronbach pointed out in an extensive study of digital social protection in Southern Africa is that where the case is strong is business case. The business case for digital cash transfers actually makes all of this make a lot of sense. Digital social protection is highly profitable for technical capital, digital capital, for financial capital, for systems, for companies that put in the digital infrastructure, for companies that run the financial systems and the payment systems, etc. And they stand to make a lot of money, not just in the fees for setting up these systems, but also in cross-selling various types of loans and insurance products, which they can do very efficiently through access to these social registries and payment systems, creating situations where a lot of informal sector companies, telecoms, financial payment systems, etc., know more about populations than the state does and have more access to them. So is this about the will to protect, or is it about the will to profit? Now, trying to assess this really comes home if we look at the contrast between the way COVID digital social protection systems worked in Southern Africa and how they worked in West Africa. And yeah, I think I can get through this with a reasonable time. So Southern Africa was the star performer, especially South Africa, in terms of the gold standard digital cash transfer response to COVID for protecting informal workers. They also have the smallest informal economies in Africa. They have already on the ground, up and running, better social protection systems, digital social protection systems. And yet they had the highest COVID death rates on the continent. It's about 6% of the African population, but 43% of COVID deaths. And it's useful to look at what went wrong to have a sense of why that might be so. Initially, there were significant registration problems. These kinds of, the registration system was highly centralized. A lot of the people who had to register for these COVID benefits, because there were a lot of new poor who had not previously received cash transfers, but were rendered unemployed due to lockdowns. They were not necessarily familiar with the system. They had to sign on. There were new COVID benefits they had to sign on. People were unfamiliar with these systems, unfamiliar with the digital registration systems. Poor digital connectivity meant that people went and sought out other people to help them do these things, not always great for social distancing. and in many cases had to travel to urban centers to complete the registration because some things went wrong, etc. Southern Africa's very strict lockdowns, and they were the strictest on the continent. They had more nationwide lockdowns and much stricter and more strictly enforced lockdowns, which involved closing markets, open markets, initially shutting down street vending, and this created extensive conduits of contagion with crowding people into supermarkets, as you can see in that picture there. And the third thing is the propensity to cash out, which some digital, both theorists and the IFIs find they voice as a perplexity. Somehow in Africa, there's a very high propensity to cash out rather than to keep things in your mobile wallet and mobile account. But if you look at the infrastructure, it's very clear why people cash out, because electricity is unreliable. The payment system, the payment infrastructure for using digital payments is even depending on where you live. Some places won't be able to take digital payments, particularly in places that rely more on open markets. And people want to get the money in their hands to know that they'll have it when they need it. And so they tended in South Africa, for example, to concentrate on going to the post office rather than holding things in a digital wallet or making digital bank transfers. And that led to situations like this, where people were crowded together in queues, sometimes for hours, sometimes even overnight, trying to collect their payments. And some research that was done interviewing people about payment collections was talking to a fellow who was explaining what it was like getting their payouts. That when we get there, there are already people who slept there the day before. I will receive the money at 3 in the afternoon. When they are closing, the line will still be full at that time, and people are pushing through one another. They are fighting. So again, social distancing very much not enforced in that way. The crowding together around payment points, around supermarkets, etc., were real flashpoints for contagion, not just in Southern Africa, but there are similar tales in Peru where people gathered around payout points, and it ended up creating very high levels of COVID death. In West Africa, you have a very different scenario. Coverage was extreme of social protection systems at all, digital or otherwise, were extremely poor. They were very much not digitized. That's a picture of a COVID payout arrangement, social protection payout in Nigeria. A lot of it was just handing out chunks of cash to people who queued up. In Nigeria, it was about 11% coverage. In Ghana and Senegal, 11 and 15%. So very few people received people in the informal economy received any form of payout. The kind of star player was Togo's Novisi program, which was its selling point was end-to-end digitization, the registration, they used AI to do the targeting, the payout, the whole thing was end-to-end digital. But it only covered, because it was a sort of pilot program, it only ended up covering about, well, less than 25% of the population, and 15% of the population lack mobile phones. So they don't even have access to this kind of payout unless they do it through the mobile phone of another, which creates all kinds of registration problems. So in West Africa, because of these various lack of digital capacity, unreliable electricity, didn't have very extensive social protection systems up and running in the first place, and so it was all very rushed, very ineffective. You ended up with much more diversified types of provisioning and support measures, which involved some cash transfers, as you can see here, food parcels, school feeding programs, various types of utility, suspension of utility payments, lots of different kinds of things, markets remained open, etc. So that there was a lot more localization of the things that were done. Tandika Mkandawire has a fabulous article in 2010 in which he looks at the different ways in which colonial states in Africa created different capacities for social protection and population monitoring types of capacities within the state. Settler economies are generally constructed in ways that have much stronger capacity to control the population and to pay out social welfare benefits. Cash crop economies, which there's a lot of West Africa, are very poor at that. The state is just not built that way. And these are much more difficult capacities to carry out. And that really was borne out in the context of COVID. So under COVID also, because of the very different structure of economies where most people shop in open markets, even elites, even big people, you don't go to the supermarket, you go to an open market to get your weekly groceries. Markets remained open, but they were constrained. They had to open on alternate days, or there are various types of social distancing restrictions, etc. But they continued to operate and people continued to go to their local open market to shop. They didn't concentrate in indoor supermarkets, which was not the best for reducing COVID contagion. There was also a lot of innovation in open markets. So some open markets in Lagos, for example, Mile 12, set up a digital payment and remote delivery system in which you could order online and they would package things up and send them by motorcycle taxi to people, so they didn't have to come to the market at all. Small businesses also created digital systems which they improvised using mobile phone ordering on WhatsApp or Instagram, motorcycle taxi or taxi delivery, mobile banking payments. Mobile money is not that up and running in West Africa, but where it doesn't operate, mobile banking is fairly secure. And this was very much, people, as they say, pivoted during COVID to continuing to operate informally, except for direct streets, like even hairdressers, extensions products, etc., in this way. So you had a much more diversified kind of engagement. Informal activities were able to run, so people managed to keep their businesses going, even at a local level, and much more limited vectors of contagion. Now, it's also mentioned that malarial zones seem to be less vulnerable to COVID, so that certainly probably played a role. So there are epidemiological reasons as well as informal economy and activity reasons and reasons for the state. So you had this kind of image of tailors not keeping their shops open, but being able to do measurements by mobile phone, bakers, etc. A lot of this just carried on at a slightly disrupted level. So to round up, I think it's useful to think about how COVID has related to the social protection agenda and how the international economy, the donors, the IFIs, and international businesses are engaging with informality as part of a narrative rather than as a kind of Polanyian double movement. Certainly, there is a pressure for digitized support for informal workers, but is it really to support those informal workers or to turn precarity into a new channel of financialized accumulation? And when I talk about financialization, I'm thinking not only of just this idea that financial actors, financial markets, financial systems have become more prominent in the global economy, but the way that science and technology studies folks look actually at the ways in which particular zones of activity are being transformed to render them amenable to financial penetration and financial. In the context of digital social protection, it's certainly clear from the extent to which it actually constitutes a barrier to access for a lot of informal workers, that there's less focus on the needs and realities of informal workers, and much more on the possibilities of secondary accumulation and the business case for digital cash transfers. So there's a lot of promotion of these systems and rolling out of the informal economy as, you know, look at these poor souls, we must do something to help them. Let's put these systems in order, pressure on the states to be these things. But much more about, if we look at the financial realities, about profiting from precarity rather than addressing it or transforming it. And I think that when we dig into these ideas, it's clear that if we focus more on the administrative and economic realities of not just African informal workers, but also African states and their administrative and digital systems, we need to do different things with social protection. I'm not denying that social protection for informal workers is necessary. I think with the increasing economic pressures and collapsing of extended family support systems, there's a crying need for social protection and health support. But is this the best way of doing it in order to not only meet the needs of informal workers, but to transform informality into something that creates a path out of precarity rather than entrenching people in precarity and creating mechanisms for others to profit from precarity? And I'll stop there.